The following is a presentation of 13ABC Action News. Now, your table is ready. Join 13ABC's Jeff Smith with the decision makers of Northwest Ohio and Southeast Michigan. This is the Roundtable.
And a good Sunday afternoon to you. Thank you so much for joining us here on the Roundtable program, inching our way toward the month of May. Coming up in our second segment, you're going to want to stick around. We will be joined by one of my cohorts here at 13ABC, announcing his retirement of late the last couple of weeks. Stan Stachek's going to sit down with me here at the Roundtable, and we will talk about not only that upcoming retirement, but life here in Northwest Ohio and Southeastern Michigan over the last 30 years of service here at 13. But first, Toledo, the city of Toledo showing up on the radar, the national radar, for all the wrong reasons a couple of weeks ago. Within the last week and a half, two people charged in the murder of a baby, a 2-day-old baby found in a freezer of all places. The body found by a landlord on the east side of town. The suspects are in jail right now, behind bars on million-dollar bonds. The story is gruesome, it's horrific, it's troubling. There are two people, those two people that, you know, they thought at this time, you can only assume that there was no other alternative to what they were going through. And we don't know the whole story at this point, but our goal today is to get out the word there are alternatives, definite alternatives out there to finding ourselves in these situations. We are joined this afternoon, glad to have with us Lucas County Prosecutor Julia Bates. Thank you for being here first and foremost. Executive Director of Lucas County Children's Services, Dean Sparks, sitting next to me, and also with us from Child Advocacy Group and Center, Vanessa Fitzpatrick. Welcome to all of you. We look at this case, and I said at the beginning before we came on, Julia, that this is a starting point for a conversation, but unfortunately, we keep having these starting points for conversation. The goal of today is to get out the word of there being outlets.
Absolutely. I mean, once again, you have a tragic situation, but if we don't take that tragedy and we don't turn it into something positive, you know, then what does it mean? So there is an alternative. There is a secret safe haven law that allows for you to surrender anonymously and with complete immunity an infant under 30 days of age, with no questions asked.
Yeah, and that has to be the birth parent, correct?
The birth parent, absolutely. To a hospital, a police station, a fire station.
And we've got those specifics we can show people at home, graphically speaking, in just a moment. But when you talk about looking at a law enacted like this, and then a case like this brings it to the forefront, is this thing, why was it not used in this case?
That's a fabulous question. Because perhaps it's not known, it's not widely known. I mean, every time we have a tragedy like this, we start again with the population of young people who might be in this predicament to try to say there is an alternative. We have been to schools, we have tried to put the posters in the malls,
I want to hold
in
this
the
up, but go ahead.
theaters, you know, as many places as we can imagine that the information would get into the hands of the people that need it. But again, you know, it's difficult.
And like you said, there is, I mean, it says right there is a secret safe haven. There is an outlet. Dean, you were gracious enough to talk to us earlier this week as this story has progressed. And obviously, initially, we had child endangering charges that were levied upon these two individuals. And then it turned into a murder charge. And one of the things you said to one of our reporters, you said, this is a process of education, but man, the growing pains of getting to the point of people being educated is ridiculous.
Well, it is, and you know, we have to say it over and over again, and we all have to, and everybody who has contact with kids needs to be reinforcing that this is an option that any parent can take advantage of for that child that's under 30 days. But I also want to point out that there are other options for even if they're over 30 days, that we are standing ready to talk with parents as they decide, I can't or I don't want to do this. We will work with them, as long as that baby is not hurt, we will try to figure out a way to help get that baby cared for. The safe haven is a great thing. You can do it, and if you don't want to answer any questions, that's fine.
Yeah.
You just give the baby to a police officer, to emergency room, to a firefighter, and they will get that baby to us, and we'll make sure that it's cared for.
And what's troubling as well, this is one that has kind of come to the forefront over the last week and a half. There have already been, here in 2012, other cases.
There have been other cases. There was another infant that was shaken. He was a resident of Lucas County. It didn't happen here. but unfortunately that child also didn't survive. So it does happen. And you know, if you look nationwide, there are 1,700 children a year that die of child abuse or neglect. That's a lot of kids, and every one of those was preventable.
When you look at this, Vanessa, this case in particular, and just the case in general, as we said, 4 to 5 here in just 2012, your job is to get out there and get the message, but how do we do a better job? We're using today as a vehicle to try to reach at least one person.
And I think reaching people and getting them to utilize the resources. Our resources are underutilized.
Why?
That's a good question. I think families forget. I think they're overwhelmed with dealing with day-to-day stressors. So they reach a stress with their baby, with their infant, and they forget about those resources. You know, we have the Crying Baby Hotline. We educate families. As they come into the hospital, it's a good gateway to give these resources to families. But once they leave and step outside with their baby, how do we get them to remember those resources and to reach out? And I think it's a community issue. I think we as a community need to just keep educating and reinforcing these resources to families.
What if somebody's out there and they're finding themselves in a troubling scenario, they've just given birth, they don't know if they can handle it, what are they going to hear from these people on the other side of the phone when they call?
They're going to hear how to soothe their baby. They're going to learn how to take time out for themselves. These hotlines are staffed with educated nurses that know how to walk a family through crisis, and they're going to tell them how to get through that crisis and then what community resources are out there for them.
Julia, from a legal standpoint, and you know this better than anybody, how do you, or does it even come into play? We're talking about people who are overwhelmed. The law is the law, obviously, and when you look at this past case, how much of it plays into the fact that people are just overwhelmed?
Well, absolutely.
Or does it matter?
At the end of the day, you know, learning how to soothe, learning how to care, learning how to nurture. At the end of the day, if you can't do that, there is another alternative. And probably the biggest hurdle in getting that information out is putting it in the hands of the people that need it. So, I mean, this is a wonderful show, and this is a wonderful way to get the information out to a lot of educated people. But how do we get the information into the hands of that young mother who has just given birth to an infant and doesn't know what to do?
And I think another big obstacle is fear, and people are afraid of what's going to happen. You know, we say that that you're immune from any kind of prosecution, but people are still afraid of the systems, and we need to get that word out. You don't have to be afraid, that we're here to make sure that that baby is going to be okay. No repercussions at all, as long as that baby's not been abused or neglected.
And there's no one there taking pictures. There's no one there detailing the description of the person.
There's not going to be somebody waiting with handcuffs.
Nobody waiting
there.
with handcuffs.
Yeah.
There's nobody waiting to take down. Of course, now if you're willing to give certain personal information, which will help, of course, in the adoption process, that's always a very good thing. But it's not required. It's not part of the law. The law says you can hand the baby over to the parties that we described and just simply walk away.
Is there not enough, and Vanessa, I want to get you in on this, is there not enough training going in to being parents? I mean, you know, we do so many topics on this show and here at 13ABC where everybody says, you know, education is the key, education is the key. But parenting, my goodness, could there be a bigger reason for education?
Right. I think that prevention, we're talking about prevention when we talk about educating parents and parenting skills, and I think that capturing people early on in their pregnancy, first pregnancies, there are programs out there to help them. There's home visitation programs, there's programs through the Help Me Grow. I think it's getting the word out and capturing those people to do more. I think that the community has those programs available. It's just capturing the people, the parents.
Well, and you know, correct me if I'm wrong, but the two of you, when you see, you know, the pregnant young person, many times I think those pregnant young people are in complete denial. Are they getting prenatal care? Have they seen a doctor? Have they even done a pregnancy test? Or are they in complete denial that there even is a pregnancy taking place? And then all of a sudden, one day, in the in the dark hours in the back seat of a car, there's a baby.
And I think that's really critical. That we've got a lot of professionals that can do great teaching, but we need family members, we need neighbors, we need friends to reach out to these young pregnant women or the fathers of these babies, to reach out to them and make sure that people go to doctors and make sure they get connected so they can have the supports.
Earlier this week, and we were out there as well, Dean, you guys held a bit of a ceremony outside LCCS talking as far as in memoriam of children who have been abused, children who have been killed. Actions like this, drawing attention to it, getting the media to come down and cover that. What is the goal?
Well, that is the goal, to make sure that people know that child abuse is real and that the consequences are dire, sometimes even fatal, but that we all as a community have a responsibility to try to respond to it. The professionals can't do anything about it unless they know about it.
Is this effective, doing things like this?
I think it does, and I know that a lot of people see these shows and they talk to us about them as we're out and about in the community, so I do think it is effective to get that word out.
I want to show people at home, if we could go to the graphics once again, if we haven't shown them yet, I'm not sure. But as far as those safe haven facts, and as Dean was saying, and Julia was touching on as well, the safe haven law allows a birth parent to leave a newborn infant with the following, and this is up to 30 days old, that infant. But Dean, you were saying there are options outside of that 30 days. You can leave it with a medical worker in a hospital, a medical worker at a fire department or other emergency service organization, and it continues that you can leave it with a peace officer at a law enforcement agency. But I think the thing we want to get out to folks, and you touched on it, Julia, is just the fact, get rid of that fear factor.
Absolutely. I mean, that's why we're saying, don't panic. Don't worry, just realize that there is help. There's help. There's available help. There's options.
There are phone numbers out there, and talk to people as far as the hotline, your hotline specifically. I know it's different than the Safe Haven hotline, but yours specifically is manned round the clock?
24 hours a day, 7 days a week. It's staffed with nurses, as I said, who are trained. The number, can I say the number?
Sure, go ahead.
So it's 419-251-5555.
Okay.
We get probably 20-some calls a year. It's an underutilized resource. We would like to see more calls because we know there's more parents being frustrated out there that can use this coaching and intervention.
When we talk about pregnancies, this last case, they were in their 20s. A lot of the times you see teen pregnancies that fear factor sets in immediately. Is there enough being done to get this info out into the schools? Should there be more? Do we start it today?
Absolutely.
I guess that's the question.
Abso-
How do we go about
absolutely.
doing that?
Well, once again, we go to the schools. We ask that they allow us to come in and leave our literature, put our posters. These posters.
Do you scare kids straight? I mean, is that?
I don't think it's it's not a scare factor.
No?
It's just to say this crosses all socioeconomic barriers.
Yeah.
This happens in the suburbs. This happens in the city. This happens to rich. This happens to poor. This happens to middle class. So let's put the information in the places where those people who need the help are going to get the information.
Dean, I want you to get in on the schools part.
Well, we partner with the schools in a lot of different things, and I think the schools are very supportive of this. I frankly haven't been to the schools to see whether these posters are still up. I know they have been put up, and any school that is willing to, we contact the prosecutor's office. We'll make sure that they get there.
Yeah, and obviously, and Julie, I think you touched on it before we came out here. These posters, they're up, but all of a sudden there's this complacency that sets in, and people just see them as part of the fabric. They become part of the wallpaper, and they're not noticed as much anymore.
Something you see every day and you don't pay attention to. So
Right.
maybe this is the sort of a jump start here again to say we need to really refocus our attention on this because this really is a community problem.
We're going to post more outlets connected to our 13ABC webpage, our Roundtable page. All of you, thank you so much for taking some time to address this issue. And stay right there. We'll be back with our second segment on Roundtable right after this.